Welcome back to the deep dive. It's great to have you with us. You sent over some really significant material for us to unpack today. It's all about a disease that's just been a source of deep heartbreak for cat owners for years. Feline Infectious Peritonitis, or FIP.
Yeah, FIP. For the longest time, getting that diagnosis, it felt like there was no hope. Just managing the inevitable decline, really.
Absolutely. And what your sources show, which is fascinating, is that the story has taken a really dramatic turn. So our mission today is to dive deep into the information you've shared, figure out exactly what FIP is, why it's been so devastating, and importantly, what these recent breakthroughs mean for cats and the people caring for them. Honestly, reading through this, the historical picture was just grim. But where things are now, it's quite remarkable.
It truly is a real shift from, despair to genuine hope.
Okay, let's unpack this then. At its core, what is FIP? The material you provided starts by linking it to a virus, a very common one actually.
That's right. FIP is caused by a mutation of the feline coronavirus, or FCoV. Now, when most people hear coronavirus, they might think of other things these days, but this is a specific virus affecting cats. Very common.
And is this common FCoV usually a big deal for cats? Does it make them sick?
Not usually, no. That's
Yeah.
what the sources really emphasize. The common FCoV is generally quite benign. It's super widespread. You find it everywhere, especially in places where cats live together, like shelters or breeding facilities. Many cats get exposed. And if they show any signs at all, it's typically just maybe some mild diarrhea, a bit of tummy upset, often nothing at all.
So the problem isn't the common virus itself then, it's something else.
Exactly. The critical point, the thing to really grasp, is that FIP only develops in a small percentage of cats infected with that common FCoV. The material points to figures, often under 10%. It happens when the virus undergoes a specific mutation inside that individual cat.
Ah, okay, so it's an internal mutation that kind of flips the switch from harmless to devastating. What does this mutation actually do? What makes the mutated virus so different?
Right. This is where it gets really interesting and maybe a bit counterintuitive. The mutation allows the virus, now we often call it FIPV, the FIP virus, to infect a particular type of immune cell. Think of these as the body's patrol cells. They're called macrophages and monocytes.
So instead of just staying put in the gut, maybe causing mild issues, the mutated virus basically hijacks the immune system's own transport system. Is that right?
Precisely. These infected macrophages, monocytes, then travel all through the cat's body, carrying the virus with them everywhere.
And that's what leads to the severe illness. Does the virus just start destroying organs as it spreads?
Well, here's what's fascinating and a really key insight from the material you shared. The severe clinical signs, they aren't primarily because the virus is directly attacking and destroying tissues. Instead, the real damage comes from the cat's own intense immune response to these infected cells spreading everywhere. It triggers this widespread inflammation, particularly around blood vessels. The technical term is pyogranulomatous vasculitis.
Pyrogranulomatous vasculitis. Okay, that sounds complex. What does that immune reaction actually do to the cat? Like, what are the effects?
Basically, the body's attempt to fight the virus goes haywire. The inflammation damages the blood vessels themselves. And this damage is what causes the characteristic signs of FIP. Either you get fluid leaking out of those damaged vessels into body cavities, the chest, the abdomen, or you get the formation of these inflammatory masses called granulomas inside various organs. It's the body's defense system malfunctioning and causing all this widespread disease.
Wow. So it's less the virus directly eating away at things and more the immune system's overreaction causing chaos. And the sources mention that this chaos can look different in different cats, right? FIP isn't just one single set of symptoms.
Yes, exactly. You often see it described as having two main forms. There's the effusive, or wet form, and the non-effusive, or dry form. Though sometimes you see kind of a mix of the two, or atypical presentations.
Okay, let's start with the wet form then. What should someone look out for with that one?
The wet form is often, well, more obvious, mainly because of that fluid buildup. You might see a noticeable swelling of the abdomen. The cat might look kind of pot-bellied. Or, if the fluid's in the chest cavity, they might have real trouble breathing. And they'll often be lethargic, just clearly feeling unwell, low energy.
And is the fluid itself distinctive? If a vet were to take a sample.
Yes, according to the material, it typically is. It's usually a yellow or straw color, often kind of sticky or viscous because it's packed with protein. And it has a specific cellular makeup that vets look for. Finding that type of fluid, especially in the abdomen, is a pretty strong pointer towards the wet form of FIP.
Okay, so the wet form has that pretty clear fluid sign. What about the dry form? You mentioned that one's often harder to spot.
The dry form is definitely more challenging, trickier to diagnose because the signs are just so much more varied. Instead of that widespread fluid, you get these inflammatory lesions, those granulomas we talked about, forming inside different organs.
And I guess the symptoms you actually see depend entirely on where those lesions decide to form.
It's exactly right. If they're in the liver, maybe you see jaundice, that yellowing of the gums or eyes. If they hit the kidneys, you could see signs related to kidney problems, kidney failure eventually. And if they form in the eyes or the central nervous system, the brain or spinal cord, that's when you see some really concerning signs. Things like vision changes, inflammation inside the eye called uveitis, or neurological things like wobbliness, they call it ataxia, or even seizures in severe cases. And beyond those specific organ signs, with the dry form, you also often see these more general, non-specific signs like a persistent fever that won't go away, weight loss, poor appetite.
That makes sense why diagnosis sounds so difficult. The symptoms are kind of all over the map depending on which organs are hit. Okay, before we dive into diagnosis itself, who is most at risk for getting FIP? Is it just purely bad luck?
The sources do highlight some key risk factors. It definitely affects young cats more often, typically cats under 2 years old. Now, older cats can get it, but it's far less common. The peak age is really quite young.
And is there a link back to those crowded environments you mentioned earlier, like shelters?
Absolutely.
Yeah.
Places with high numbers of cat, shelters, catteries, even some multi-cat households, they see much higher exposure to the basic FCoV. And where there's more exposure to that common virus, there's just a higher statistical chance of that mutation occurring in a susceptible cat down the line. Stress is also definitely a factor. Things like the stress of rehoming or surgery or even just being sick with something else that can potentially increase susceptibility.
What about genetics? Does that play a role?
Yes, the material points to a genetic predisposition in certain breeds. You often see Bengals, Abyssinians, and Persians mentioned as having a potentially higher genetic risk. And finally, having other infections, particularly ones that suppress the immune system, like feline leukemia virus, FLV, or feline immunodeficiency virus, FIV, but those can also increase the risk.
Okay, I need to circle back and clarify something we touched on. If a cat actually has FIP, the mutated form, can they pass that FIP virus directly to another cat? Or is it just the common coronavirus that's contagious?
That is a really, really important distinction, and the sources make it quite clear. The FIP-causing mutated virus, the FIP, is not considered highly contagious from cat to cat. What is contagious is the common, usually harmless feline coronavirus, the FCoV. So cats in a household or a colony might pass that common FCoV around easily. But the risk of FIP comes later, from that common FCoV mutating inside a susceptible individual cat. You don't generally catch FIP directly from a cat that has it. You catch the common coronavirus, which might then mutate in that newly infected cat.
Okay, that's a crucial point for anyone worrying about their other cats if one gets diagnosed. That's helpful. So, with such variable signs, especially in that dry form, and no single obvious symptom, how do vets diagnose FIP? The sources say it's not a simple test, right?
No, it's definitely a puzzle, a diagnostic challenge, because there isn't one single definitive test that works easily in every case. Diagnosis really relies on piecing together multiple clues. It's about the cat's history, the clinical signs the vet observes, and then the results from various tests.
What kind of tests are we talking about? What are vets looking at?
Well, for a cat showing signs that fit the picture, especially if it looks like the wet form, analyzing any fluid that's built up is really key. Looking for that specific profile, high protein, low cell count, that sticky yellow appearance that's highly suggestive. Blood work is also absolutely essential. The material highlights very characteristic changes in blood proteins. Often you see high globulins and low albumin. This leads to a very low albumin to globulin ratio, the AG ratio. That ratio is a strong indicator of the specific kind of inflammatory process happening in FIP. You might also see other things like changes in white blood cell counts, maybe anemia.
What about testing for coronavirus itself? Can they test if the cat's even been exposed to FTOV?
They can, yes. They can run tests for coronavirus antibodies. These show if a cat has been exposed to any feline coronavirus at some point. But here's the catch. Since that common FCoV is so incredibly widespread, a positive antibody test, even a high level, a high titer, it doesn't automatically mean the cat has FIP. It could just mean they were exposed to the common harmless virus weeks, months, or even years ago. So antibody tests are just one piece of the puzzle. They're supportive, maybe, but not definitive for FIP on their own.
Okay, so if that's not definitive, how do you get closer to a real diagnosis?
This is where the more specific tests come in. the ones that look for the virus itself or bits of it
Yeah.
in the places it's causing problems, so in affected tissues or that fluid. Techniques like RT-PCR, which looks for the virus's genetic material, its RNA, or another one called immunohistochemistry, which uses special stains to identify viral protein right inside the cells from samples. Finding the virus in the fluid or in a tissue biopsy where the inflammation is happening, that's much more specific evidence pointing towards FIP.
And imaging, like ultrasound or x-rays, do they help?
Yes, imaging can definitely help. Ultrasound, for example, can help vets visualize fluid in the chest or abdomen. It can also show changes in the size, shape, or texture of organs, potentially revealing those inflammatory lesions, the granulomas, in the dry form. Ultimately, getting a tissue sample, a biopsy from an affected organ, and sending it for histopathology, looking at it under the microscope and combining that with immunohistochemistry. That's often considered the gold standard for a definitive diagnosis. Though obviously getting a biopsy isn't always practical or safe for every cat.
Right. So it's really about gathering all these different pieces of evidence, the symptoms the owner sees, the vet's exam, the fluid analysis, the blood work, maybe imaging, and maybe those specific virus detection tests, and putting it all together to build a strong case.
Exactly. Especially with that tricky dry form, it's about collecting multiple clues that all point in the same direction to reach that diagnosis.
Okay. And historically, once a vet did put all those pieces together and reach that FIP diagnosis, what was the outlook? You mentioned earlier it was grim.
Oh, it was devastatingly grim, just awful. For decades, FIP was considered basically untreatable, a death sentence. The prognosis was almost universally fatal, usually within just weeks or maybe months of diagnosis. The only care available was palliative, just trying to keep the cat comfortable for the short time they had left. There was nothing else to offer.
That picture is incredibly stark, just hopeless, really. But your sources talk about a dramatic shift, a revolution almost.
They do, and it really has been a revolution in treatment. It's thanks to breakthroughs in antiviral therapy, specifically a class of drugs known as nucleoside analogs.
And the sources highlight one specific compound, one drug, that's really changed the game for FIP.
Yes, absolutely. It's a compound called GS441524. It's particularly notable, actually, because it's a molecular relative of remdesivir, which people might know is a human antiviral drug used for other things.
Interesting. How does this GS441524 actually work against the FIP virus?
Its mechanism is quite clever. It directly interferes with the FIP virus's ability to replicate its RNA, its genetic material. It essentially gets incorporated into the new viral RNA strands being made, and then it stops the copying process. It jams the machinery, preventing the virus from making more copies of itself inside the cat's cells.
And what have the results been like? I mean, how effective is it really?
The efficacy data described in the material compared to the historical prognosis? Well, it's nothing short of miraculous, honestly. Studies and, importantly, real-world clinical use are showing really high success rates, often exceeding 80%, particularly when treatment is started relatively early. And even cats with the more challenging neurological form, which used to be completely hopeless, have shown significant responses, although they often need higher doses or maybe longer treatment courses.
Over 80% survival rate for a disease that was essentially 100% fatal just a few years ago. That's truly incredible. What does the treatment typically involve for the cat?
It's generally quite intensive. It's usually a 12-week course, so 3 months. And the drug has to be given daily during that time. Traditionally, it was by injection, which can be tough, but oral formulations are becoming more common too.
Okay, so we have this highly effective treatment, a near miracle drug. What's the catch? Because the material points to a pretty significant hurdle in actually accessing this life-saving drug.
Ah, yes. This is the really complicated and, frankly, frustrating part of the story. Despite its proven efficacy, GS441524 is not officially approved for veterinary use in many parts of the world, including major places like the U.S. This is primarily due to complex regulatory pathways and patent issues, which are kind of tied up with its relationship to human antivirals like remdesivir. It's a bureaucratic tangle.
So if it's not officially approved, how are cat owners actually getting it for their pets? People are using it, right?
They are. This is where you hear about the underground markets and compassionate use networks mentioned in the sources. Basically, desperate owners, often connected through online groups, see the documented success stories in the studies, and they end up sourcing the medication through these non-traditional, sometimes legally gray channels.
Wow. That sounds incredibly stressful for owners, and potentially risky too.
It absolutely can be stressful and carries risks, which is why the material strongly emphasizes the absolute necessity of veterinary oversight, even when the drug is obtained this way. Working closely with the veterinarian is crucial. First, to confirm the diagnosis is actually FIP, then to figure out the correct dose, because that can vary based on the cat's weight and the form of FIP they have,
Hmm.
and also to monitor the cat closely during treatment for response, but also for potential side effects, things like liver enzyme elevations or reactions at the injection sites if they're using injectables. Plus, the vet provides all the other essential supportive care, maybe nutritional support, managing secondary infections or inflammation. So while the drug itself is the key, that veterinary guidance is still absolutely essential for success and safety.
It's such a complex situation, isn't it, where the science has kind of outpaced the traditional regulatory processes. Okay, so with treatment offering so much hope now, what about preventing FIP in the first place? Can we stop that initial mutation from ever happening?
Well, prevention, as the sources outline it, focuses primarily on managing and controlling the common feline coronavirus, the FCoV, in the cat's environment. Because remember, that's the starting point. No FCoV exposure, no chance for mutation.
Right. So how do people do that, especially in those multi-cat situations like shelters or catteries?
The key measures highlighted are pretty much good husbandry practices. Things like maintaining excellent hygiene and sanitation, cleaning litter boxes frequently and effectively to reduce the amount of virus in the environment. Reducing stress is also seen as vital, avoiding overcrowding and housing. These factors can increase how much FCoV a cat sheds and might also impact a cat's immune system, potentially making them more susceptible to that mutation occurring. Minimizing stress during particularly vulnerable periods, like weaning or rehoming for young kittens, is also mentioned as important.
And just regular vet visits, keeping cats generally healthy.
Yes, absolutely. Regular veterinary monitoring is important for overall health, which can influence susceptibility, and of course for early detection if any issues do arise. For breeders, the sources also mentioned considering genetic factors, maybe using genetic testing where available, and implementing breeding strategies to potentially reduce genetic susceptibility in certain high-risk lines over time.
What about vaccination? Is there actually an FIP vaccine?
There is an FIP vaccine available in some areas, yes, but the material indicates it has shown pretty limited efficacy in actually preventing the disease in real-world conditions. And because of that, it's generally not widely recommended by veterinary professionals as a core or primary prevention strategy. So the focus really remains on good management, hygiene, stress reduction, careful population control, managing FCoV exposure where possible, and just being vigilant for any early signs of illness.
This has been a truly remarkable deep dive, really eye-opening. We've gone from understanding this bizarre way a common virus can turn deadly because the immune system sort of malfunctions,
Yeah.
through the varied and often difficult to diagnose forms of the disease, to this incredible, genuinely life-changing breakthrough in treatment that was, frankly, unthinkable just a handful of years ago.
It really highlights how quickly medical understanding and treatment can evolve, doesn't it? Bringing real, tangible hope where there was essentially none before. It's quite something.
And the sources you provided really emphasize that continued research, responsible practices in managing cat populations, and simply increasing awareness among cat owners and vets. Those are the crucial next steps.
Absolutely. The journey isn't over. There are still challenges,
Yeah.
but the outlook for cats diagnosed with FIP is just fundamentally brighter than it has ever been.
So here's maybe a final thought for you, our listener, to sit with after hearing all this. We've explored a situation where a highly effective, life-saving medical treatment exists for a devastating animal disease. Yet accessing it is filled with challenges, tied up in regulatory and patent issues that seem kind of stuck between the worlds of human and animal medicine. What does this complex intersection of scientific breakthrough, established regulation, and the urgent, compassionate desire we feel to save lives, whether human or animal, what does that tell us about how we, as a society, value and facilitate access to medical progress in the modern world?
It's a powerful question, isn't it?
Mm.
About ethics, access, innovation, and maybe where our priorities lie. Lots to think about there.
Indeed. Thank you so much for bringing these sources to our attention today and for joining us for this deep dive into feline infectious peritonitis. It's been truly eye-opening and actually quite inspiring.